Hello, I'm Dr. Sophia, one of the doctors looking after your father. I understand this must be a very stressful evening for you. Before I explain what's happening, could you tell me what you already know about your father's lung condition and how he's been managing at home? I know he has something called COPD, but I don't really understand what that means. He's been more short of breath this week, but he wouldn't see a doctor. I see. Thank you for sharing that. COPD stands for chronic obstructive pulmonary disease. It's a long-term lung condition that makes it hard for the lungs to move air in and out. People can have good days and bad days, but sometimes their breathing suddenly gets much worse. We call that an acute exacerbation. That's what's happened tonight. Does this mean he's going to die soon? I understand your worry. Right now, he is stable after we gave him oxygen and medication to open up his airways. This episode is serious, but it does not mean he is dying tonight. We are monitoring him closely, and we will treat the cause to give him the best chance of recovery. What caused it? And has he been getting the right treatment at home? There are a few possible triggers. A chest infection is one of the most common. Sometimes, if inhalers aren't used regularly, breathing can worsen. Changes in weather or exposure to smoke or dust can also set it off. From what you've told me, he may have had symptoms for several days. That's why we'll check for infection, review his inhaler use, and see if any environmental triggers are present at home. Should the hospital keep him for observation? Yes, I recommend we admit him tonight. This will allow us to continue oxygen therapy, give nebulizer treatments, start steroids, and, if we find signs of infection, give antibiotics. This close monitoring is important in the first 24-48 hours. Will this keep happening? Will he ever recover? COPD is a long-term condition, so flare-ups can happen again, but we can work together to reduce how often and how severe they are. After this episode, I suggest a full review of his inhaler technique and medication, pulmonary rehabilitation exercises to improve his stamina, vaccinations to reduce infection risk, avoiding smoke, dust, and cold air when possible. While COPD can't be cured, many people live well for years with the right treatment plan. Our goal is to keep him active and minimize future hospital visits. I'll keep you updated regularly tonight. If you have questions or notice any changes in him, please let the nurse or me know right away. You've done the right thing by bringing him in quickly. That made a big difference.